Good afternoon, everyone, and welcome to this, the second in our webinar series all about the Prevention Concordat for Better Mental Health. My name is Richard Thorne. I'm from Kaleidoscope.
I'm Lily McCura from Public Health England.
And I'm Anna Howells, also from Kaleidoscope.
And welcome back if you joined our first webinar last week. Last week, yes. Seems a long time ago already, when we talked about the events which are coming up over the next couple of months to talk about better mental health all across the country. The topic for today's webinar, I think it's a really important one when talking about how to achieve better mental health across an area. It's all about better partnership and alignment. I'm really pleased to be joined by two fantastic speakers today who will introduce themselves in turn. So I think we're going to have some great presentations, but a lot of today is all about the discussion and the questions which come from you. So we really welcome your comments, questions, advice, suggestions, tips, other words meaning exactly the same things as we go through. And Anna, do you just want to talk about how people can get involved?
Sure.
Today?
So there's two ways you can join the discussion, either using the question facility that should be on your screens in front of you, or by emailing hello@kaleidoscope.healthcare.
And if you want to get involved on Twitter as well, you're very welcome to. The snappy hashtag is Prevention Concordat. I will try and count the number of letters in Prevention Concordat. What's that, 16? So we like our, well, did I even get that right? Oh, well, let's move on. But a nice snappy hashtag. Please do use Twitter. Please do send in your questions and thoughts as we go through. If you do have any technical difficulties, we are recording today's session, so you'll be able to watch it at your leisure afterwards. I think that's enough for just the preliminaries now. I think, Lily, you're just going to remind us what we're here to talk about.
So the Prevention Concordat is about preventing, doing more action locally and nationally to prevent mental health problems and promote good mental health. What we really want to achieve as we on our joint journey to success is also improving the number of areas across the country that are involved in better prevention planning and the range of arrangements that may lead to do that, but also in particular involving a whole number of cross-sector partners. So whether you're local government, NHS, health, you're an employer, private sector, all the voluntary and charitable sector, then we'd like to have you involved.
So, Lily, if there's anyone on the line who's thinking, I'm not sure if I should be here, probably the answer is going to be
yes, absolutely. And you can see by the number of and the range of signatories that we have and people who are involved in developing this work, both in terms of the steering groups and our journeys around the country in the preparation for launching the Prevention Concordat, shows that we actually had quite a wide range of people. And we'd like you to be involved both by being part of these webinars, but also by joining us at the learning events and other activities that we've got going on over the next few weeks and months. So we've got two streams of ways that you can mainly get involved. So obviously, if you've got the opportunity to come to an event, and there's a list of the locations and dates on the slide next to us, we're in Durham next week, and then we could go around the country, ending in Liverpool towards the end of March, and then we'll be carrying on over the next in the next financial year to look at other ways of engaging you in face-to-face. But really importantly, these digital conversations are really a good chance to hear, listen and learn and exchange ideas about how we can exacerbate or escalate the way that we're working together.
If we can focus on escalation, probably rather than exacerbation.
Escalation.
Exacerbating the good stuff. Let's do that.
Yeah, so we want to share all of the evidence of what works in order to deliver the change that we really want to see, which is more prevention and better promotion of good mental health. Lily,
thank you very much. Again, if you have any questions about the Prevention Concordat or the programme events as a whole, please do put them in. And although today's focus is all about partnership and alignment, we do welcome questions on all topics. Lily, there's 20 events in total. We're 2 down already. Yeah. So the second discussion today. Next event is next week in Durham.
Next week in Durham, yes. And so we've designed the events so that they appeal whether you're leadership and influencing others, whether that's within your own organisation or within across partners or in the community. But also if you're a practitioner, come find out and see how you can engage, both in terms of your own offer and an opportunity to learn and share resources with others.
Lovely. Lily, thank you very much indeed. And so you flagged a range of documents and tools and resources already available. How can people get hold of those?
Right, so we are hosting all of the resources on Public Health England's website. So that's at phe.gov.uk. You can also very handily Google Prevention Concordat, and that will actually take you directly to the links for all of the resources. But you'll also find the Prevention Concordat platform, which hosts all the links to how to get involved in the events as well there. We're also tweeting, as Richard has already said, using the hashtag Prevention Concordat. And actually that's been a great way of actually very quickly sharing ideas and also building the cultural change and movement that we're trying to do with this work.
Excellent. Lily, thank you very much indeed. Well, so I think we won't have much more of introductions because we really want to get into the substance of the discussion today. But just to say, the next 5 webinars, this being the first, are all about 5 components, I think, which were part of the Prevention Concordat planning resource, which was published in August.
Yes, so in August, what we did was we decided that because people were asking for some of the pathway of what to do, we released some guidance as well as other practical tools, and that's going to be the theme for a number of the first phase of webinars that we're running, which cover things like leadership, joined up working, how do you galvanise more action, well, again involves leadership as well as your local community members.
Excellent, thank you very much. So we're going to, although we've got this partnership focus, I'm sure we'll stray into lots of interesting areas over the next 51 minutes. Excellent. So Anna, do you just want to remind people one last time how to get involved today?
Yep, so either using the question facility in front of you or by emailing hello@kaleidoscope.healthcare. And then also on Twitter, the hashtag is hashtag Prevention Concordat.
Excellent, thank you. So let's move on to our first presenter, and we're really pleased to have today with us Tamara, who's the Assistant Director for Public Health at Haringey. Tamara, you're joining us by voice, so we're going to do a technological marvel of you joining by voice and us moving your slides seamlessly, and I'm sure this will work perfectly. But Tamara, over to you to talk us through your approach to mental health and wellbeing, the journey you've been on in Haringey.
Thank you very much, Richard, and thanks for inviting us to present our case and how we implemented Concordat in Haringey. I'm joined here with Director of Public Health, Janelle de Gruchy. But I'll mainly take you through the presentation now. So on the slide, second slide, please.
Yeah.
So we've started our journey slightly before the Concordat has been published, but we have been part of the national and regional discussions on what the good public mental health and overall mental health and well-being should look like, and how one embeds prevention at the local level in the local authority. And we started our journey with 3 main, under 3 main areas. So we talk a lot about informed leadership. We used health in all policy approach, strategic shift to prevention and early help across the system, and crucially working in partnership across the whole system with the CCG, our local authority, mental health trust, voluntary sector, and our residents. When we talk about informed leadership, what I mean here and what Concordat really articulates clearly is in order to get everyone on the same page in terms of what mental health and well-being challenges are in the borough, one need to do information, one need to use information and intelligence. And when we started this journey with something we call Haringey Stats, which is really almost like a narrative of what the mental health in one borough looks like, and it's the event where Chief Executive of the Council presents the data supported by ourselves, and then we go through a discussion as to why this data, what this data is showing, and what are particular things that we could potentially address as the whole system. And that really helped us to get everyone on the same page. We had police in the room, we had mental health, local mental health trust, and they were all senior strategic leaders. So starting from that base, we really gathered the momentum as to prioritizing mental health locally. We've also published JSNA chapter and we've conducted resident survey on mental health and well-being, where we ask about 1,000 residents on different questions in terms of their mental health and well-being, but also different risk factors that might influence on mental health and well-being. So we were well informed as to what are the priorities and what are the needs in Haringey. We also have political leadership, because Mayor's chosen has mental health as a theme for last year. As I said, we've used the health and all policy approach, and we established a whole system governance. The way we did it is really what we realized we needed to do is to have the whole system vision and to articulate main priorities for public mental health. And what you can see here is it's slide 3. Sorry.
Yeah.
The leadership was in public health, but what we were doing is we had 6 months of a series of workshops and engagement across the borough to come up with a joint vision for mental health and wellbeing framework. And this is simply all residents in Haringey are able to fulfill their mental health and well-being potential. And what that means is mental health, everyone has a mental health, but it's different. It means different for different people. For some people, it means having a good employment, and for some people, it just means getting up in the morning and going out to the shops, basically. So we wanted to articulate that there's a various range of needs in our community. We came up with 4 priorities, and you can see the first priority is about mental health and well-being prevention, but the rest of the priorities are more about the services. But what we have done is try to embed prevention into all 4 priorities. Slide 4. In terms of really public mental health, we had a small budget locally, but we also have managed to get some external funding and also to work with other partners to come up with a number of interventions. And what you see here is we recognize that our communities are diverse and they have different needs. So we had about 6 or 7 different interventions, ranging from time credits to involve people in volunteering to something we call Thinking Space, which is a group therapy innovative approach. And then we also had approach to mental health and well-being in all schools. And we also have a specific project working with young people who are at risk of offending or have been offenders. So basically, we have mobilized the whole system, but then we, in public health, were responsible for particularly delivering one of the 4 priorities. Achievements over the last 2 or 3 years, in terms of the partnership we realized that the money for public health or mental health was across the system. So we came up with a Section 75 and pulled all the funding from the CCG, local authority, and mental health trust in one pot, which really enable us to work towards the joint outcomes. We have, as I said, established a range of innovative projects, and we were really lucky to receive Health Service Journal Awards for 2 of our 7 projects. We have seen a decrease in suicide rates significantly over the last 4 years. Our school attainment increased, and we have also a project on mental health and employment, and we saw about 40 people with severe mental illness getting into employment and maintaining employment. The project I talked about, young offenders, we've got over 130 young offenders engaging over the last 2 years, and of those, 47 are now accessing employment and education, which is absolutely a fantastic achievement. On our journey, certainly there have been lots of challenges, but there are also lots of opportunities. Haringey has a very high level of mental health need, and it's very diverse need, whether we're talking about one part of the borough or the other part of the borough, and then it's increasing complexity needs as well. Resources are finite, so we had to use some creativity as to how to get external resources. But once you have a strategy and vision, I'd say that helps attract some funding, external funding, and when you start seeing some outcomes, funders are more likely to put more money into your strategy, in a sense. We have had underdeveloped recovery models and models of care in the community. We have one of the priorities of mental health framework is developing enablement program. So we have come some way, but this is something that I think will take a much longer term and more investment from Mental Health Trust as well. And then the lately, I'd say, is we've recently signed Memorandum of Understanding as a part of the Health and Care Agreement for London, where Haringey will be a pilot borough for mental health and employment, helping people who have mental ill health to maintain their employment, or helping them early in their illness not to progress to longer term unemployment. So I think that's all for me for now, and I'll be happy to take any questions.
Tamara, thank you very much. That's a wonderful run through and nicely succinct as well. Thank you. Really clear themes there of the use of data to get all of these various stakeholders literally in the same room, in the same place. Strong political commitment, as well as being able to embed prevention across a whole wide range of areas rather than just in one or two. I'm sure a number of themes which we're going to come back to when we reach our discussion. So Tamara, thank you very much. If you have questions for Tamara, please do pop them in using the various ways you can get in contact with us. We'll come to those after our second speaker. So very pleased that Victoria is joining us from Bristol City Council. And Victoria, I think you get a special PHE Learning Events Gold Star for this. Despite this only being our third event, you've been volunteered perhaps, to take part in two of them. So that's you have our appreciation for that. Victoria.
Hi everybody. Likewise, it's brilliant to join you. And I guess here in Bristol, I've been here just a year. And so what I'll be talking through is almost what we've taken from the Prevention Concordat so far, and some of the things that have tended to work really well. And I guess our take here in Bristol is we're probably focusing less on creating a really coherent, robust, comprehensive mental health strategy in its own right, but trying to ensure that mental health is embedded, particularly on a new thing that we're doing called the One City Plan. So trying to find ways to ensure that mental health gets embedded in the big city strategies and programmes of work that are taking place. So if we go on to the first slide, please. I guess the first thing that we would say here is that the Prevention Concordat and all of the information you've given us has offered us a really helpful opportunity to start rebalancing our thinking, our effort, and we're hoping to see in time the resource that we give to prevention. And I think my background is mental health, and very often when you're asked to come in and do a programme or a strategy on mental health, it is the things like IAPT and its services, and it's very much in that place that we often go to. And I think the Concordat has helped remind us that at best, I'm stealing a Health Foundation graphic on my slide if I may, but at best, the things that keep us healthy are at best 10% to do with our health, access to health services. And it's much more about the family we're born into, the friends we have, the house we have, the job we have or we don't have. And I think it's been a really helpful process to really look at your resources and be supported by Public Health England to be able to kind of ensure that we then take what we know in that respect and start embedding it into what we're then doing. So if we go on to the next slide. So I guess the very beginning is you've given through the Concordat the most comprehensive array of indicators that we now need to be included in our JSNA. So through that, we're really clear in Bristol, we've got much higher levels of poor mental health. Our suicide rates are far higher than they should be. We know 1 in 5 of our young people are self-harming, which is a really terrifying concept when you think about it. And we know that the people who are already mentally unwell are much more likely to smoke here than they are in the rest of the country, and as a consequence, more likely to die far too soon. So the process of you giving us far more indicators and going into much more detail about where in the city things are more problematic has been really helpful. I would say if there's a way of making it a bit more succinct so we don't have to get all that data, that would be brilliant. But I guess that'll be in version 2. But if we go on to onto the next slide rather, I think the thing that the Concordat has steered us towards that we wouldn't have done otherwise is really making the economic case in the city. And this is probably the one thing that we've done that I'd recommend everybody do, because it's really, really transformed the way the city takes an interest and acts upon mental health in an incredibly short amount of time. So we were really lucky to work with the Centre for Mental Health and a member of our public health team to start working out what the cost is, the economic and social cost of poor mental health. And through their support, we now know that that's about 1.37 billion per year, which is a phenomenal amount. But we can also start breaking down where in the city that cost is being incurred. So we know that 280 million is being spent by employers through not doing the things that we know the evidence says they should do to keep us all mentally well and healthy. And so by doing that, I can't stress enough, it's led to our mayor quoting that figure repeatedly. It's opened doors with commerce, with business, with a whole range of partners that is enabling us to take things into a kind of bigger realm, if you like, than would otherwise be the case. So if we go on to the next slide. The other thing that Concordat did was it made reference to some other initiatives going on around the country. So one is called Thrive, and that began in New York City. As often is the case, the mayor there had a very direct personal experience of poor mental health in their family, and then started to think about what can a city do to keep people mentally well. So what New York did, they had money that I don't think any of our watchers or listeners have got, but what they did do is really work out what the evidence says about what we should do in our schools, what we should do the minute someone's pregnant and before, what we should be doing throughout the life course to really, really make a difference for public and individual mental health. So what we've been lucky enough to do is our Deputy Mayor has been able to go over to New York twice, but also we've been involved in the models that have started to be embedded over here in the UK. So Norman Lamb led a brilliant initiative in the West Midlands, and London have done the same. So in a couple of months, we're going to be launching our version, which is Thrive Bristol. And essentially, we're borrowing all of the concepts from the Prevention Concordat about working in partnerships and all those sorts of things, but using the kind of Thrive model. And as I'll talk about later, I think the essence of the model is public health not necessarily having all the, well, not definitely not having all the answers and not the solutions, but for the city partners to start understanding what their responsibility is around mental health, what the evidence says they should do, and really galvanising them together to start coming up with those solutions. So on the next slide, I think, what we've taken from both those Thrive models, but also the Concordat, is trying to, in our work to try and influence the city, having a really coherent approach ourselves. So we've totally kind of borrowed the models that you've described about having a whole population approach. So we're now working in partnership with Mental Health First Aid and considering having ambitions like 1 in 5 Bristolians in the next decade, having access to things like mental health first aid training, and starting to work out how members of the city, for example, our corporates, could help us to fund having a resource like that we could then put back into our businesses, but also start rolling out in the parts of the city that would never be able to afford that kind of support themselves. We're also doing work with Time to Change so that we can try and ensure that there's a great deal more awareness across the city and using their resources at a national level, at the local level, and sharing that. And as I mentioned at the beginning, we've actually got agreement from our mayor for something he's creating, which is a one city plan where transport, commerce, health, education, we're creating a single plan that's going to take us to 2050. And he's agreed for mental health to be an overarching principle and priority for that work. Again, we'll be borrowing ideas from everywhere around how we take that forward. But we're hosting the Global Summit of Mayors in October. So that's an opportunity to sort of show what we've done so far. So beyond that, we're taking a life course approach, lots and lots of work on children and young people, but particularly thinking about what expertise have we got in the city. So we're really lucky here to have 2 universities, University of West of England and the University of Bristol. For very real reasons, they've had to become real experts in mental health. So what we're trying to now do is ensure that that expertise and skill gets shared across the city, for example, with our further education colleges and sixth form colleges. So it's not public health trying to find the money to do things, it's almost looking where the expertise is and working out how we can start sharing that more broadly. I'll talk in a moment about the employment piece we're doing, but then I guess on the sort of final tier is about our targeted prevention. So we are working a lot with domestic abuse charities and thinking about how we can ensure people who have experience of domestic abuse and mental health needs are having both of those recognised and well supported. Our homelessness charities are looking at models like Housing First that other parts of the country are rolling out and starting to think about how we can make a business case locally to get similar investment to bring to Bristol. We're doing things on arts. We're using Google Analytics, interestingly, which is a really cheap mechanism to start understanding what people in your city are typing into Google, so the language they use, where in the city people are typing what in, but also to then start evaluating, if we do public campaigns, how that influences things like Google Analytics and to be able to get that real-time data in a way we haven't done before. Lots of work on smoking, on debt, on all those things that we know need resolving, but it not being us doing it, it being our city partners that are charged to take that away and say what they can offer, but also make an ask of the city as to what they need help from us to be able to kind of realise these ambitions. And I guess finally, all of this sounds very ambitious, and I guess the big challenge with lots of this is to make sure partners like Bristol City Council and our CCG are also walking the walk when it comes to mental health, if we're asking others to do the same. And so my next, and I think penultimate slide, is just an example of that. So we often get really good national reports coming out, but it doesn't always translate locally. So what we've done is Paul Farmer and Lord Stevenson did a report about thriving at work and workplace mental health. So what we've now got is in the city, we've got a big law firm company, one of their partners, we've got our unions and Mind coming together to kind of chair a task and finish group, start thinking about how do we take that and how do we operationalise it in Bristol and operationalise it at scale. So it's our businesses, our unions and people with lived experience who are looking at that and saying, here's how we can actually embed this in Bristol. We're offering support for them to do that, but it's led by them and it will therefore hopefully be much more likely to land well. And I guess then finally, it's just the final slide, is just to sort of reiterate, we're at the real beginning of this, but I think our ethos is about it being the city leading this, the city being given the support to understand what the evidence says and what we offer the information about local needs, but for them to be supported to then make this stuff happen. And I guess trying to sort of embed it in our housing, we're building many thousands of new houses over the next decade or two. So really thinking about what those opportunities look like in terms of how we create mentally healthy housing stock, or how we align our employment opportunities and those sorts of things is where we're at. But it's really early days. I guess it's promising that people are really passionate. The other thing we're doing is we're considering how we create an STP-wide prevention concordat so that we can start doing this at scale and aligning what we're doing with our two neighbours in partnership with the NHS, which would be interesting to know if others are doing the same. So thank you very much.
Victoria, thank you. Again, lots of content there, and I'm sure people will have lots of feedback and reactions. Just to play back some of those themes, a clear drive to embed across a whole city's plans, not just within public health. The power of the economic case to galvanise people for action. The sort of the breadth of the ideas you've borrowed from elsewhere really came through. But I think more than anything, I think anyone working on public health needs to go to New York at least twice. I think that's a key message for us. So do we have New York on our event schedule? Is that coming up? Victoria, thank you very much indeed. It's about past. We've got about half an hour for questions and discussions. So Lily, I'll turn to you in 1 second just for any initial reactions and questions back to Tamara and Victoria. But Anna, once more, just to remind people how to get involved.
Yep, so you can either join using the question facility on your screens or by emailing us at hello@kaleidoscope.healthcare.
And our snappy Twitter hashtag?
Yeah, that's hashtag prevention Concordat, all one word.
Thank you very much. Lily, reflections, questions for Victoria and Tamara?
I think two things that really struck me, which were the common theme of evidence-informed decision-making and evidence-informed leadership, because actually that's really driven, in a sense, what you're doing on the ground, but also how you're getting, whether or not it's individual leaders or organisations that you need to be involved to engage. Is there anything you wanted more to say about that or reflect on that?
Evidence-informed leadership. It's a lovely phrase. Victoria, should we start with you and then go to Tamara?
Yeah, I think the one thing, my reflection, I'm still really new to public health, but I guess the challenge sometimes is the breadth of information you're given on the different interventions there are and the kind of what the evidence is telling you. And I know that's nothing new, but I think where we're thinking at the moment is we've got a real role in public health to try and be really clear about when public services are probably going to get smaller and money's going to get far less abundant. I guess where we're at is trying to be really, really clear about what are the small number of interventions that would make the most difference in a city or in an area. And that's something that we're constantly perplexed by. But I guess that relationship between us locally and you guys nationally to really, really synthesize return on investment, but being really clear what are the, if you can only afford a very small number of things, where do you put that? And that's kind of where we're at.
Victoria, thank you. And Tamara, sort of reflections on ensuring that the leaders involved in the work are equipped with the right evidence to make the best decisions.
Yes, before I go on to that question, I'll just say that I was in New York as a part of a study visit from London Mayor, and we have a London tribe which we launched in July last year. So there is a team there. In terms of the intelligence and informing the leaders, I suppose what you have usually is different parts of the story, different parts of the system have different story for the same set of information, for example. So what was crucial in that workshop that I was trying to explain is to come up with one set of information, like single version of a truth, where people discussed and aired their views, and then with the fantastic facilitations from our chief exec, we kind of managed as a group to come up with a common conclusion and be all on the same page. And I think that was really crucial in the engagement, but also when it came to delivery, people had the same narrative, and we all know from all different perspectives, but we kind of had one narrative for mental health. I also wanted to say something about evidence-based interventions, and when we talk about public mental health, it is catchy, and there are some things that there is evidence-based for because we have evaluated, but there are some things that we know that they work and they're common sense, but we haven't evaluated. It doesn't necessarily mean it doesn't work. So we have had interesting a journey with our politicians and members, trying to persuade them to put some money into group therapy for strengthening community resilience, innovative piece of work that came from Brazil. And we started that after riots in Tottenham, and we had to really go through the overview and scrutiny, and we had to have a compelling narrative as to why we would like to take this risk and invest those money in. But how we try to mitigate this is by building in evaluation from University of East London, and that's where we got politicians' approval to do this piece of work. And now 3 years into it, it's seen as one of the best practice pieces of work we have, and we've got evaluation and evidence that it does work. So one shouldn't stop doing some innovation, and we go for like 80% evidence-based, 20% potential innovation. But it does take some persuasion at the local level to be able to take those risks.
Tamara, that's a really nice point about getting that balance right between where you do have the evidence, where you don't, but it doesn't necessarily mean that it doesn't work. Very nicely put. Thank you. And there are themes which people might want to pick up in their questions. Anna, do we have questions coming through?
We do, and thanks to all who have sent them through so far, and please do keep them coming. The first question we have is from Veronica, so thank you, Veronica, and this one's for Tamara. So Tamara, could you just share how long the programme that you mentioned was running for from inception to start? And she'd also be interested to learn more about the evaluation framework. How were the outcomes attributed to projects?
Lovely. So length of programme and evaluation framework. Let's restart with that one.
Yeah.
Lovely. Great. Tamara.
Okay. Thanks for that question, Veronica. This is not a quick fix. So in terms of, let's say, the first workshop where we talked about what mental health issues are in Haringey, until the implementing first project, it took about 9 to 12 months, developing a strategy and having that common framework, and then finding resources to commission. We have commissioned these interventions for now 2.5, 3 years. I mean, the different length of time. And we tried initially to have a common evaluation framework for all of them. It hasn't necessarily worked. We have used this resident survey, and in that resident survey we used a Warwick Edinburgh questionnaire, which was like just an assessment of mental health and well-being. And we did that in 2015 as a baseline, and we're going to repeat this now this year, because we now implemented that as a part of the ongoing resident survey. But when it came to evaluation outcomes, what we decided to do is for 4 of these 7 interventions, we built in a specific evaluation, and we commissioned different universities to do these pieces of work, because we thought it needed to be quite specific and focused.
Thank you very much. And Victoria, we'd like to pick up any of those points. And you're very welcome to tell us that in Bristol it's very quick and easy to do, and evaluation is a piece of cake, or maybe not. Victoria.
We're really at the beginning, so we're just having conversations with our universities to try and ensure that at the very beginning we've got our baseline data and that we've got real expertise looking at it. But we've been really lucky that some national bodies like the Centre for Mental Health and others have been really supportive in terms of helping us to understand the sorts of metrics we should be using to be able to evaluate this at scale across the city. But really early days.
Sure, thank you. Anna, more questions?
Yep, this question's from Matt, so thank you, Matt. And he says that, so he thinks it was implied in both talks, but what efforts are being made to influence the local conversation about mental well-being, especially around challenging stigma?
Great question, Matt. Thank you very much. Victoria, do you want to start?
We're really lucky here in Bristol that this is a conversation that's been going on for some time. In Bristol, we were a pilot hub for the Time to Change hub, so that was about 3 or 4 years ago. And we've also got loads of kind of people with lived experience who are running charities. We've got something called Freedom of Mind. There's young people that have come together and host big concerts and events and other things to try and really normalise talking about mental health and bring it into the mainstream. So we're really fortunate here that there's something for public health to do to try and ensure that that's a coherent conversation, that it's getting to all the groups that need to be having it. So particular work at the moment is being done with our Somali population and other groups who may use really different language or may have really different ways of engaging on mental health, and that's something that's really important to us. But I think there's something about just letting people who are running groups, who've got lived experience, to communicate this and trying to give them as many ways in which they can do so, and in which they can be regularly talking to our health and wellbeing board and our other kind of decision-making boards to ensure that people with lived experience are shaping the agenda.
True, thank you. And Tamara?
In Haringey, we have taken like a multifaceted approach in terms of tackling stigma, because again, there's no easy fix, and I suppose different communities are more likely to talk about mental health than the others. So we have regular things such as like World Mental Health Day, where we engage the whole borough talking about mental health. We have mental health first aid training that we deliver to residents as well as all frontline staff. We have a big push on workplace mental well-being, and I also lead on the workplace well-being for North Central London STP, where we have those conversations and we publish stories about people having mental health, especially at the senior level, and that's been really received very positively. We have one of the lucky things is we have a Haringey's mayor who chose his 2 charities from that started last year. His 2 charities were local mental health charities, Mind and Studio 306. And he is now engaging all schools, for example, in a competition, a What Makes You Happy t-shirt. and we have events in March on laughter. We want to break Guinness record on laughter yoga. But what we so there are different things, different ways how one engages in terms of tackling stigma. But one thing I'd say is there needs to be ongoing conversation. So you gather this momentum, but if you don't do any sort of borough-wide engagement, it kind of tails off. So you do need to potentially do it at a regular basis. Now that we have a London Thrive, we're also part of a London Thrive campaign for tackling stigma, and this solution booths across London are really helping tackle that stigma at the whole city level.
Lovely. Thanks very much, Tamara. Lily, I'm going to come to you in 1 second. I think we've got one more question waiting there. But it'd be great to get your reflection on this really strong theme here about political leadership being so important. But let's take one more question first.
We have one more question, and this one's for Victoria. So do you think it makes it easier if you have a unified local authority support as opposed to cities with multiple local authorities?
Yes, we're really fortunate. Our mayor at the moment is a guy called Marvin Rees, and he used to work in public mental health here in Bristol. So I think it's a really unusual set of circumstances where you have somebody whose job it was to get a city to care about mental health, then being the leading figure in the city. So yeah, I think that's the case. However, I would say we're now part of the STP, and so we are North Somerset, Bristol and South Gloucestershire, and the political makeup of these areas are phenomenally different, and they work really differently. So we're learning really quickly about how we can try and get a shared approach as much as possible between such different areas, and how we can use mechanisms such as our new West of England Combined Authority, which is a devolved body that's getting lots more resource and other things, how we can start to kind of work together to be able to tap into new ways of getting resource and political support like that.
Victoria, thank you very much. And Tamara, do you want to pick up that point about, we talked quite a lot today about partnership working within a local authority. Observations you have on the challenges and successes you've had in engaging across local authorities?
I suppose the good thing is that mental health seems to be a cross-party priority, and it has been for the last, 5 to 6 years. So I think that is really good in that sense. I was just reflecting when we were listening, Janelle and I were listening to Bristol presentation. It is very different. Our borough has about 260,000 population. I don't know what's the Bristol population, but then in London we're talking about 7-8 million and 32 boroughs. We have always worked within this regional landscape as well, because this journey on developing London Thrive has started about 3 years ago. Janelle and myself are also mental health leads for London, and we sit on the STP, NHS Mental Health Transformation Board. So we have worked across all boroughs, but sometimes it's quite difficult, first of all, to engage and inform everyone on what's going on, but then having a systematic approach. So what we tend to do is to have like a minimum, optimal or maximum of what one should do in their boroughs, and then leave it to independent boroughs really, and depending on the needs of the population and depending on the leadership and depending on the resources to implement whatever they think suits them best.
Thank you very much. Again, I'm sure there are themes there which people might want to pick up in questions. Lily, a constant theme about the importance of political leadership.
Yeah, so my comment here really is based partly as well, based on listening to what's been said today, and also having worked in 4 different types of local authorities. So I think clearly with political leaders, what we're wanting to do is actually really get them to understand what the evidence base is and strengthen their understanding and application of that. What's clear is that there's something about making sure that they get that message in terms of the data and intelligence, but also convincing people with that very strong narrative, which again, the examples, if I say, from Haringey, which is about storytelling and using illustrations, And then actually that sort of model works, whether that's a city, a rural environment, whether you're talking parish councils or larger. And I mean, I had the fortunate opportunity of getting out and about. So earlier this week, I was, sort of listening to some examples that were from City of Salford, hashtag My City Salford, and other places like that, where they're looking at actually how do they use local communities to also help influence leaders, so that it becomes very much a circle as well there. So, and I think as well, and I think the other thing that seems to be coming through very strong here on where you are leading the way. So again, the examples today in particular are where you've convinced leaders to be both brave and bold with it, as well as being open and curious as to what are the opportunities that they could take, either directly taking the mental health heading or through other opportunities, through again through looking at things like housing or work with partners and employers and others.
Really, thank you very much. Well, just picking up on, I really like your point about the use of storytelling here to sort of to galvanise and bring people around a common agenda. A question from me, if I may, to Victoria and Tamara, in terms of when you are working with partners across your area, and you're trying to get them interested in what they can do around public mental health, it's not as if they don't have other things to do. And we've mentioned a few times that sort of budgets are finite, and there are a range of pressures across public services, which I think we're all well aware of. Are there any sort of practical strategies you can share about how you've managed to get other areas not just to come along to meetings and nod politely and then go away again, but how actually that's turned into real action? So how you've managed to sort of show the case to other areas, but managed to work with them to actually deliver a change rather than smiling and nodding. So Tamara, would you like to start, then Victoria?
Smiling and nodding is crucial as well. Sometimes I sit in those meetings and sometimes it goes for hours in terms of regeneration, and you say one sentence and you can just suddenly see the change in thinking. And you're right, you can't just, you have to have evidence to be able to persuade others that mental health is everyone's business. I think from my point of view, the things that really are powerful, some of the cost effectiveness data and some of the stuff and some of the evidence of saying, for example, in our young offenders, 80% of our young offenders have mental ill health, and 100% of all young offenders in Haringey have engaged in substance misuse. So when you present that data, then suddenly knife crime and tackling offending takes a different level or a different approach. So it's really using the evidence in that sense and trying to persuade people, but also not coming necessarily just from public health point of view, but from other services point of view. In terms of adult social care, 35% of expenditure is on people with mental ill health. So if we start investing in supporting those people, helping them with employment or maintaining their housing, certainly social care costs will go down. So in terms of this financial climate that we currently live in, this is one of the crucial things that I think helped us win people over.
Oh, lovely. That ability to put yourself into the shoes of those others and what their priorities are, seeming an essential characteristic of a successful public health team. Victoria?
Echo all of that. And I guess the one thing I'd add is almost going where the energy is. So I think in recent months, it's become really apparent to us that particularly with young people, either in further education, in universities, or just entering the job market, we are hearing from employers and from academic staff and others that there are particular needs that they have that are definitely not currently being addressed. So I think, we are making the economic case that our universities and our employers need to do things differently. But I think going to where they're calling out for our help and actually they know that young people want different things from their employers, want different things from their universities, but also may have particular needs. There's something about how we can really come in and support them and work in partnership. So I think there is something about being really choiceful about where you put your energy. And if you go where there's that real need and where people are really calling for that help, then I think we can achieve tons more.
Really nicely made point, Victoria. Thank you. Anna, how are we doing with questions?
Yep, we have another one on the list. So this question is for Victoria, and you mentioned data on self-harm. So how did the team gather the evidence about local prevalence of self-harm?
I'm really sorry to say that's we're lucky that in Bristol we've got a really comprehensive data set of young people that were born in the 90s. So essentially that's not something that's applicable elsewhere, but we've got a data set that's giving us this information. But we've also got a self-harm register that's based in our hospitals that public health contributes towards. And that's been a really important tap of really understanding who's at least turning up at our A&E settings self-harming, and trying to understand the sorts of things we can be doing differently to help them when they're at that point, but also in school and in a broader sense too. So that relationship with our self-harm register and those academics has been invaluable.
So I think the message there, Victoria, is if you want really good data on self-harm, move to Bristol. Learning, that is. But just Lily, to pick up on actually the point Victoria made earlier, that there is a whole range of data you could use to get an insight into the particular challenges in the area. But it's about how you focus and how you choose. What advice would you give to an area thinking about those issues?
So if you're starting from scratch or want to revisit, what we've tried to do essentially is try to make some of that easier. So we have recently launched a joint strategic needs assessment tool, which includes all the sort of data on risk factors, prevalence, protective factors, where we have them, and other assets that will apply to your local area. So that's really easy to navigate. And also we've now started to add in some additional information again to help guide people through. If you wanted to say spotlight on perinatal mental health or on self-harm, then you can drill down into that data. And again, that's available if you Google Prevention Concordat, then you'll get through to the fingertips tools and other resources. But as colleagues have said online, there's actually also that, we do encourage you to look at what else you've got around. So that may be, for example, some data that you've already been involved in setting up, such as anonymised hospital registers or services, but also look at your VCSE partners. So, for example, we know that Citizens Advice Bureau have got a platform that they have got access to, which again is capturing a number of pieces of data which are relevant, not just about debt and citizens' advice problems, but also again more about sort of domestic circumstance and other trends. So again, use those as much as possible.
Lily, thank you very much. We're almost out of time. We've got 6 minutes left. So if you've got any last minute questions, please do. Now is your moment. I'm going to throw in one last one, if that's okay, before we do closing reflections, which is Victoria and Tamara. You're both talking from an urban standpoint, and we've talked about New York, of course, which I've heard is slightly urban as well. And how different do you think the issues are between urban and rural areas in constructing a really sound public mental health strategy? So how specific some things you've been talking about today to an urban setting rather than rural, how much does it carry across? Victoria, to start.
I feel really poorly equipped to answer it because I am based in Bristol and my entire background has been working in urban settings. But I guess we do work very closely with South Gloucestershire and North Somerset. And I think obviously things like transport, obviously things like, the amount they have per head can often be very, very different. And politically, things can often be different in rural settings as well. But I guess the one thing I've learned from working with those colleagues is sometimes areas can be deemed to be not high in poverty, and Bristol we're pretty much red on lots of these RAG ratings that you look at, and so it's really clear that there's a case for change, and it makes it quite a lot easier to get people to be galvanised around that. I sometimes think in rural areas poverty and real needs can be concealed sometimes by those figures. So I guess it's something about being really mindful and helping people to realise that maybe your average is okay, but there can be incredible need hidden away that maybe isn't as vocal and isn't as easy to see as is the case in our cities.
So thank you very much. Tamara?
I haven't got much of the experience really working in rural areas, but what I do know for urban areas, and specifically Haringey and London, is extremely diverse borough, and there are 300 languages spoken in Haringey, and I suspect rural areas are maybe not as diverse. So our strategies really look at all sorts of different communities, and it's sometimes harder to have the whole borough approach. You need small different approaches, targeted approaches for different communities, whereas potentially in our rural areas these things might look slightly different.
Well, thank you very much indeed. We've got 3 minutes left, so what I'd like to do now, if it's okay, is just to go around. Colleagues here, colleagues joining us, speakers have just joined us, just to get one closing reflection from the discussion today. I think we've had a really great discussion. Thank you again, Victoria, Tamara. Thank you to those who've sent in questions. Just a reminder that we've been recording today, and it will shortly be available on the preventionconcordat.com website, so you can share it with all of your friends and family, who I'm sure will be very keen to watch it back. So a closing reflection. Lily, would you like to kick us off? And we'll start here and then go to Victoria and close with tomorrow.
I think my first thing is that it's really clear, is be really confident and do all you can to know what you need to know about your area, but also at the same time remain curious.
Lovely. Great. Anna.
Yes, I was really interested to hear about the creative ways of showcasing data and engaging partners that Victoria and Tamara both mentioned, whether that's using Google Analytics or involving universities.
I think mine would just be, I love the point about political leadership and storytelling, and how important it is just to be able to make clear, if you want this to be everybody's business, you've got to find ways to be able to tell that in a really clear and convincing way. And I think that's really well demonstrated by both the stories we've heard today. Victoria.
I still feel fairly new to this area, but I guess the key things I've seen make a biggest difference is the economic case and being able to spell out what a city's already paying for this, but also having city partners be the ones to tell the story rather than public health. So be our voluntary sector, be our businesses, be it others, for them to be the ones communicating why this matters, and acting on it themselves is the most powerful way.
Okay, thank you. And Tamara?
For me, there is something about alignment, and when things, so what I mean by that is you have a national push and prioritization on mental ill health. Then you have, let's say, Public Health England coming up in Concordat, and then you have political energy at the local and regional level. So when all of these things align, then you get much more of a momentum to be able to change things for better.
Thank you very much. And that brings us to time. So just to say again, thank you so much for joining. Thank you, Victoria. Thank you, Tamara, for sharing your stories so convincingly. And if it's okay, Victoria, Tamara, are we okay to circulate the slides to people who joined?
Sure.
Okay.
Yeah, sure.
Excellent. Thank you very much. We'll do that just after this call. A reminder that the next digital discussion to join is next week, 25th January, 1 till 2 p.m, where we're going to be talking all about needs and assets assessment with the wonderful Andy Bell from the Centre for Mental Health. But for now, we'll say thanks very much. We hope to see you at a future one of these discussions or face-to-face. Great. Thanks very much all.
Thank
Bye.
you.